Good evening. I'd like to call to order the meeting of the Caldwell County Department of Social Services Board Meeting. Today is Tuesday, January 30th, 2024, here at the Alden East Starnes building. We'll get started with our Pledge of Allegiance, and we will follow that with the invocation by Chapel Davis. All rise for the pledge. Face the flag. Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Bow your heads with me, please. Dear Heavenly Father, we'd just like to ask for your presence with us tonight as we meet. Lord, we ask that in all that we do, that we include you in our decision-making, so that you will help us to do the best we can for this county and for those who are at risk. We pray your special blessings upon those supervisors at DSS and all of the hard workers at DSS. Lord, we just pray that you will pour out your blessing upon them and your provision and your discernment and your wisdom. And we ask that you do the same for us as a board, Lord, so that we can honor you in all that we do and do the best for this county that we love so much. And we pray all these things in Christ's name. Amen.
Amen. Amen. Thank you, Chapel.
You're welcome.
All right. Next on the agenda is there any amendments to the agenda tonight?
No amendments.
No amendments. All right. Need an approval of the last meeting's minutes. Need a motion to approve the minutes.
I'll make a motion.
I'll second.
Have a motion and a second. All in favor, please say aye.
Aye.
All opposed. Motion carries. All right. Next on the agenda is going to be a hybrid remote work pilot extension request. Ms. Brandi Hood with Economic Services Administrator and Elizabeth Franklin, Economic Services Program Manager.
So I'm going to cover that for them tonight.
All right.
So I'm going to talk about our pilot for just a minute. As you know, we have had our economic services area doing this pilot now for about 3 months. And we've had some issues just surrounding some technology, which I think we've got worked out at this point. We've also had some barriers and some with getting accurate statistics because there have been obviously the holiday season. Lots of people were taking vacations. We had some day sheet issues, and so day sheets are where staff have to code time to certain programs. And with Medicaid expansion, there was some confusion and some lack of training from the state around what codes to be using. And so we had to get some clarification around that and some additional training around that, which took extra time and effort. Also, the technology issues and then some policy changes around expansion and the additional training that required. And so what we are asking of the board tonight is to allow us to extend this pilot to the end of March so that we can really look at how productive this work arrangement is. I don't want to end this pilot without real tangible results so that we can decide whether or not this is something we need to move forward with or whether or not this has just not been helpful or productive. And so what we would like is for the board to decide and agree to or say yes or no to whether or not we can extend this through March before we have some final results.
Do you think the end of March is going to be enough time?
I think so.
Okay.
I think that'll give us 6 months. And when we can extend it through the end of April, I think, again, more time is not going to hurt. If we wanted to wait until the end of April, I think that Brandi and Elizabeth would also be fine with that, and I'm fine with that.
Are all the IT issues resolved?
For the most part, we've polled all of the workers who are in this pilot, and they said they have been able to get connected to the network and remain connected to the network. There are some things that are just not going to be resolved, and those things are delays in printing. So when we print from the field, there's a delay because of just the transmission of the signal. And there's some other things that are just going to be a little different when you're working remotely. That's not going to be as easily accessible as when you're in the office. And so we need to figure out, and that's what we want to do in these next 3 or 4 months, depending on, what you as the board decide. What we want to figure out, some workarounds and some things to help with some of those kind of barriers.
How about the training? Training's done?
Training
Everybody
is-
understands the right coding and all that?
As far as day sheet coding, yes.
Okay.
There have been policy changes kind of ongoing, and so they continue to train in regards to different changes in Medicaid. There's one coming up, which I'm going to talk about in just a few minutes, another training that they're having to go through for another change that's happening. So our policy training is just consistently ongoing.
Well, personally, I'm a fan of the program, so I'd like to see us maybe go through the end of April to give us
Okay.
time to work out,
Yeah, I'm fine.
Yeah, I think
Any,
that, I think certainly by the end of April, we're going to have some good
I
statistics.
think you'll have a better understanding of it personally.
How many do you have in the program again? I know you've mentioned, I just don't remember. what
So
you
we started with the expectation that we would have 10, and then it was reduced to 7 because not a lot of folks, there were less folks that we thought would want to participate. So there were 7, and then we had to bring 2 back into the office just due to productivity issues. And so we have 5 right now.
said. Okay.
And they're from different program areas, so that's helpful.
Do we need to make a motion?
Yep.
So I will make the motion that we extend the hybrid remote work program through the end of April.
And I'll second that.
All right, I have a motion and a second. All in favor, please say aye. Aye. All opposed, motion carries.
Donnie, do you mind, before we move on, can you move that plant that way? Can you set it
Oh,
Jacob's
just
gonna-
so that I can?
Tracy and I can't see each other.
Thank you.
Thank you.
is that better?
Yes.
Okay, fantastic. All right, next on our agenda is outreach and collaboration, and I've got, tonight, we've got our Restart team with us tonight, and that'll be Crystal Henderson will come and talk to us about child welfare, staff development supervisor.
So I'll just say real quick, we have been really trying to involve our other county departments and community agency and doing some collaboration. And Crystal has been key in doing a lot of that through staff development. And she's on here several times to talk about some things that she's been really active in. And some of these things have been her and Chastity's ideas. And so we're very excited about these things.
So I think you guys know Jenna, and I see Jason's here, but,
It may not,
okay,
she
so.
may not. I
So
don't know
we
if she does
have,
or not.
Not sure.
some of our Restart folks. We have Jason Powell, who is kind of the coordinator, right, of the
Come on
Restart
up, Jason,
program.
so everybody can see your beautiful smiling face.
He was trying to avoid it.
Yeah.
And then we have Jenna Hamby, who is one of the peer support with Restart. But we really wanted Brittany to come tonight and be introduced to you guys. We recently hired Brittany Williams. She is a social worker that's working now with Restart, but she is an employee of DSS. And so we were able to kind of finagle some stuff to be able to have her position, and I know we're really excited. Jason and I feel like we probably interviewed 2,000 people, but really feel like 2001, but the 2001 was it, and so we're really excited to have Brittany. Brittany has a lot of experience in the community. She's worked at Robin's Nest. She has worked at the courthouse. She's worked at the domestic violence shelter. So she just has a wide array of experience that she can bring this team, and we're just really, really excited. And I know they are too about having her now. And so we also want to talk about, though, a little bit of the collaboration that we've done as an agency. As you know, we've been working with them a lot lately, and really just going to their area and them coming to our area and really talking things through. And we recently had a situation where we had a mom, and this mom has had children removed from her previously, which she was never able to reunify with due to substance misuse. And so she recently had a new baby, and this baby was also born substance affected. And so we immediately reached out to Restart from the moment that we got the report that this baby's born, and we immediately reached out to them. They contacted the mother in the hospital, and were really able to partner with them. And Jenna called a bunch of places, and she said this was kind of new for her, but she found a facility where this mother could be released from the hospital and go to with her newborn baby. which really prevented us from having to take custody of this child, but also kind of gives her another opportunity to get it right this time. And so we're really, really happy about that. We're really thankful that we have this group of folks that are willing to help us and partner with us and work with the community too.
Well, I think three of us know what Restart is, but I don't know that Chapel may not know. She doesn't know. And there's a lot of people that may be watching our meeting tonight that likes to watch DSS meetings. We've never had Restart come, so I'm glad you're here. Tell us a little bit about what Restart is. You ain't got to go in depth, but tell us a little bit about what you are and what you're doing. That way the community can tie the two together.
So I'm going to say that Restart is a post-opioid overdose response, but I'm going to let Jason kind of talk a little bit more about the program because that's more his wheelhouse, and I want to make sure that we get it right. So.
Thank you, Crystal. Thank you. Yes, so first time here for the board of DSS. Been here quite a few times before, Mr. Potter. So yes, Crystal kind of hit the nail on the head. We are a multidisciplinary team. Again, we've got paramedics, we have peer support specialists, we now have a social worker, and we are a post-overdose response team or an overdose response team, however you want to look at it. So we not only respond to 911 calls through emergency services, but we try to be that puzzle piece. So if anybody knows anybody that's been active addiction, in that active use, there's those moments that are breaking moments in their lives. And when they reach out a hand, there needs to be a hand there to grab it. Because that's a point in time, that is a moment that we could have reached them. Not sending a business card, not saying call these people, not saying go see this, but actually being there and doing and being a face for these folks, being advocates. Every one of us in this program has been affected. We have a little lived experience, and that is paramount in this role and in this space that we occupy, the folks that we come in contact with. So we try to be that puzzle piece on the front end. Not only do we do it really well as far as reaching out and touching folks post-event, 24 hours, 72 hours, 96 hours from that event, incarcerated population, folks from RHA, folks that come across with Lenoir Police Department, you name it, we don't like to say no. However, we get the referrals that come into us. And as it worked this time, it just happened to be DSS. It just happened to be DSS right upstairs. And then Gina was able to go through, do her due diligence, learn along the same pathway. You know, this is kind of muddy waters. It's not crystal clear, and especially for us here in this region, because we don't have many resources. So not only want to be on that front end, we also want to be on that back end when folks do seek that coverage and do seek that recovery and start that pathway, because recovery is not a destination, it's a pathway. You don't just step across the line and you're there. Mm-hmm. So we want to eventually be on that side of it as well, using us as peer supports to have folks reach out to us and to keep that hand extended during that pathway to recovery.
Perfect. Thank you, Jason.
Thank you.
You guys want to share anything else? You did a good job. You did a great job.
We're very thankful.
I think when you look at what I think, and Jason kind of touched on this, when you look at the Restart program, it's a support team or a post-overdose response team, but, that's just, to me, it's a small part of what they're doing. There's a whole lot of other things that are intertwined into this from an outreach standpoint. I know you guys have recently been doing a lot of things with the homeless population. Yeah. Just what you did with this lady. So she wasn't overdosing, right? That wasn't a post-overdose type situation or an emergency type situation, but it was something that you were able to get involved in and help that mother and also obviously help the child. So no better place for a child to be than with their mother, even in the darkest times of substance abuse type situations. So I appreciate you guys doing that, and I'm proud of what you guys are doing, not only from, I guess, like I said, your outreach and all the other stuff, but you guys are doing a wonderful job. And sometimes we forget that this is a very complicated situation. I myself forget that quite a bit. And there's no silver bullet to solve this problem. But I can assure you that we have good people that are making a valiant effort every day, 24 hours a day, to to try to help that. Would you like to say anything? You're standing there.
I'm glad.
You're standing there looking like you want to say something.
I mean, I'm obviously glad to be on the team. It kind of turned out to be the perfect opportunity for me, so I'm just glad to be here.
Kind of best of both worlds, right?
Yeah, it is actually. Yeah.
Anybody else got any questions, comments? All right, we appreciate what you guys do. Keep up the great work.
Thank you, guys.
All right. Next on our agenda is quarterly information sessions with DSS. That'll be Miss Beverly Ruppard, Adult Services Supervisor, Laura Harrison, and Brandy's not here this evening.
So we're just going to let Crystal and Chasity are actually going to talk about this.
Oh, yeah, you told me that.
Yeah.
And I actually marked it.
I'll be her support person.
There's a whole list of people on this list right here.
Yeah,
So.
there is.
So this is something it kind of initiated from Caldwell County, no, from Lenoir Police Department, actually. And so they reached out to us, and we've had a pretty good relationship with Lenoir PD over the past couple years, and we've gone in a few times and provided training to them. And so one of the things that we did throughout that training was just kind of explain to officers and just work with them, try to have a better relationship about what our role is and what information we need from them to help our staff understand what law enforcement's role is. Because even though we're there working together, our duties are very different. And so we started that, and we had one of the lieutenants there reach out to us and ask us when they hired new folks if we would be willing to do that, like a smaller orientation with them when they hired new officers. And of course, we were very happy to help with that. And so that kind of has blossomed into something that we're looking at now, doing like a quarterly meeting. And we are doing that not only with child welfare, but we're doing that with economic services and also adult protective services, where we can kind of explain our role to them so that they know what they can do or who they can refer to, maybe services. You know, sometimes they meet people that they may not know, hey, go up DSS, they're going to help you with some emergency assistance, or when to call APS, when to call CPS. And so we're very hopeful, very, really want this to work out. Hopefully we can partner some good relationships. I have one of the things that we had talked about doing, and I'll hand these to you if you'll pass them around. But this is a little card that we made, and we're going to send these out and have these printed, but I just wanted to kind of give you guys something that we hope to hand out at these informational sessions so that it's something that an officer can put in their pocket, or we're going to open this up to school teachers, hospital staff, things like that too, these informational sessions, but something that they can keep on them so that they have readily available when they need to call DSS.
Crystal, do we know of any other counties that do a similar thing where they meet with the police department like this? Or
I'm not aware of any.
Okay, it's a great idea.
No, we haven't. We've talked about this for so long, and just how we really need to, we've done some training with law enforcement, just specific to the sheriff's office and specific to LPD. And then, we've talked about over time, just we need to, when they have new officers, because they have turnover just like we do, just like everyone else does. And so we kept saying, we really need to get the new officers trained and educated when they come in. And so we actually were in the FEMA training not too long ago, and I was talking to someone with LPD, and it just blossomed into this. And he's like, well, I'm over the training, program at LPD, so I'll reach out when I get a new officer. And he's now reached out twice.
That's great.
And so then we started talking about, well, we need to offer this to other people, not just law enforcement. So it's kind of how this just blossomed, and we're really hopeful that it's beneficial and that the other county departments, but also other community agencies take advantage of it.
I could see how it could fit into sort of the crisis collaborative that we have, like somehow or another, that it connects into that crisis service spectrum that we've been trying to figure out, like how that works in the county. So.
Yeah, definitely.
Well, I'd like to commend LPD, Lenoir Police Department, for, taking the initiative to do that and being interested in that. I would like to see other agencies do the same because I think there is a big barrier between DSS and law enforcement and, fire department, EMS. So hopefully this can spread a little bit across the other agencies, across the county. So I like it. I think it's great.
I think a lot of that stems from a misunderstanding of our roles.
Yes,
I agree.
I would think so.
And just a lack of, well, I won't say a misunderstanding, I should say a lack of understanding
Lack
of
of
our
knowledge.
roles.
Yeah, just a lot,
And
just
so-
what you don't know what you don't know, right?
it.
So chipping
You think
away
you
at
know.
that, right, and
Yeah.
so chipping away at that from the beginning, we
Yeah.
hope to really establish some good working relationships.
One of the things I would recommend you do is maybe reach out to the community college and see if you can get a slot in their BLET programs, or you could come in and maybe spend an hour, however long it takes to do it, to get a little bit of a, just plant that seed in the early stages of that law enforcement officer's career.
Yeah. It's not bad, it's a good idea.
Yeah, and the paramedic program, and, that's out there, because they encounter the same stuff as law enforcement do.
Well, it just gives them more tools too, because
That's
I'm
right.
sure sometimes they're frustrated on a certain call, not knowing what to do. And so this just puts other tools in their arsenal, so that's
Yep.
great.
And so
Right.
what we could potentially do is let them know when these quarterly sessions are going to be, so that they could then ask their students to attend.
Yeah,
Yeah.
So then we're not having to
Do extra.
duplicate.
Yeah.
They can just attend the programs that we are going to offer.
Yeah.
Because we hope to have them scheduled and consistently offered.
Nice.
So,
Thank you,
that's
Kristen.
wonderful. Thank you, Crystal. Thank you guys for doing that.
Crystal
All
has-
right. I'm sorry.
She has more to talk about.
Oh.
She's the show
agenda
tonight. Crystal's the show tonight.
I'm working for that merit too.
Yeah.
Yeah, there you go. That's item number 7. It's got a lot in it right
It
there,
does.
so
It
it's
does.
hard to read through all of it. All right, next on the agenda will be Crystal, and she's going to talk to us about the resource fair, correct?
Yes,
Yeah.
yes. So this is something that, I guess since I've had this position, is something that I've talked about doing, because we have a lot of turnover. There's new agencies in our community that provide services. There's new social workers. Sometimes workers will, when you're talking with them about some type of an issue that a family is having, they just don't know where to refer those families to. And we have a lot of new service providers, especially with some of the systems of care and things like that, that we don't know about. And so I had this idea a couple years ago about, can we get all of these people together at one time so that they can kind of talk to our social workers, social workers can go through, they can put names with faces, be able to get those resources, kind of fill up their toolkit of services in our community. And so we really, really started planning this and looking at it, and we were thinking about, the Tammy Austin conference room would be great, but then when we really started sending this email out, we have had to expand this to the library. So we're in the bottom room of the library, and this will be coming up in April. We currently have 38 different service providers who have committed to come and set up a table. There's a lot of places that have reached out that I've never even heard of, didn't know that they existed or what services they provided, and so we're really, really excited, but we're opening this up to all DSS staff. And so this would just really be a good opportunity for employees to come to learn about what services are there, to make those connections. Maybe folks in economic benefits will have a family that comes in, and maybe they have a child that has some behaviors, and they can say, hey, there's this program in our community that may really help you with this or provide some support to you. So we're really, really excited about this. I'm excited about it.
That's great, and that's when again?
This is April the 3rd. It's from 10 to 2 at the Caldwell Library.
All right, that's fantastic. All right, anybody got any questions about that? Great work. Sounds like a good idea. Super excited to have you come back maybe in May and tell us how it went.
Yeah, I'm really excited about it. I'm excited to learn these resources too, and just kind of put faces. Sometimes there's a lot of people that, I've been at the county for several years. There's a lot of people that I've talked to multiple times, but I wouldn't know them in a crowd.
Yeah, what kind of who do you anticipate being there? Like, give us an example.
So Western Piedmont Council of Government is coming, and they've asked for, I know like specifically they've asked for 2 tables because they want to talk about, they have services for the aging population, and then they also have housing resources, so they've asked for some separate things. Children's Home Society is coming. They're going to talk about some of their post-adoption services, some, foster care recruitment and licensing. They have intensive family preservation, so they're going to talk about that. We have Veteran Services is coming to talk about what's in the community that can help clients that we're working with that are maybe veterans.
4-H is coming.
Yes, 4-H is coming, which I thought was interesting. That's not somebody I thought about, you know.
Yeah, I wouldn't have thought
I
about
know
it.
that one stuck out in my mind, too.
Yeah. I know the National Guard contacted me, and I said, you know, my response initially to them was, you know, this is a fair for our employees, because I thought, are they coming to recruit people for the National Guard, you know?
Yeah.
And she said, yes. And she said, you know, we offer a lot of services to people who are active duty or families who have somebody active duty. And so, you know, I never thought about that. And I don't think you would if you're not involved in that. And I think that's true for a lot of us. If you've never had that situation where you've had to reach out for that service, you don't know it's there.
Yeah.
Chris, this is a great idea.
It's a great
We have some
idea.
good ideas.
Well, good.
And Restart, I'm assuming Restart's
Yeah, absolutely.
will be there, and then EMS, emergency services, yeah.
Yes, our community paramedics
Okay, community
will be
paramedics, yeah.
there. The health department is setting up some tables, WIC, the Smart Start program,
Is this for all county employees or just DSS employees?
we had just said DHHS, but,
Yeah.
I mean, I
See, I'm
don't,
thinking more along the lines, there might be some county employees that don't even know these services, like some people, employees that work at the library, you know, or wherever they might work, the
Yeah.
administration, they may not know some of these services are available.
Right.
So,
Yeah, we can consider opening it
Yeah.
up if it,
the paramedics,
yeah, I'm
All
definitely not
services.
yeah.
opposed to that. I think it would be good information, so.
I
Yeah.
agree with you. You may have to find you a bigger spot if you start, you
Yeah,
know, grow that.
might have to grow it to an outside event, have it
Yeah.
at the fairgrounds.
Well, you got the civic center.
Yeah.
Yeah, I mean, that's true. You know, I was thinking like Ferris wheel, you know.
Yeah, oh, yeah,
County to fund that.
yeah. All right, any more questions?
Thank you, Kristen.
Thank you,
Thanks,
Crystal.
Thank you.
Appreciate you. All right, next on the agenda is going to be long-term care emergency plan training, Miss Beverly Ruppard, and April. Yep, there's April.
Yep.
Okay, I'll just be honest, when I had to go that FEMA training, I was like, oh my God, what in the world? But apparently a lot's come out of it, you know. Kim started that
See?
collaboration. I know. And when we were in there, we were talking about facilities. You know, one of the group I was on in that training, we had a nursing facility that needed to be evacuated in our little scenario. And so that's something that could really happen. We have 9 facilities in our county. Well, it wasn't but a couple weeks later, the Triad Healthcare Preparedness Coalition reached out to me about doing a training in our building for long-term care facilities on emergency evacuations and operations. So I was like, yes, because
I know how to do this now.
I was still in my disaster relief mode or whatever. So what they're going to do, they're going to come, and it's going to be from 10 to 2. And what I've done, I reached out to Vic Messenheimer with emergency management, because DSS monitors the assisted living facilities, and I know that they have to give him a copy of their disaster plans. Skilled nursing facilities are monitored by the state, so I'm not sure how they have to do that. But I reached out to Vic because I felt he needed to be a part of this. And the timing was perfect too, because we had just had a facility that we thought we were going to, they had an outbreak, and we didn't know if they were going to have to quarantine, if we were going to have to evacuate them. And at the time, we found out that their disaster plan was a disaster. And now for DSS, one thing we've done is we require the assisted livings to give us a copy of their disaster plan every year when we do their monitoring for that. But Vic's excited. He's going to be there so that we have a representative from EMS. And then he also reached out to Jordan Kramer, who's the compliance program coordinator at UNC Caldwell. And he is going to sit in too. So I'm really excited about this. It's going to be EMS, adult services, and the hospital. And as of right now, 7 of the facilities are coming. I'm just waiting to hear back from 2 more.
And so where are you doing this?
We're doing it 3rd floor training rooms at the Health and Human Services building.
Okay.
It's from 10 to 2 on February 7th. And the Triad's also going to be providing us lunch, so I'm really excited about this.
Yeah, I wouldn't give the one that's holding out on you, I wouldn't give them an option. Just tell them they have to be there.
It's a skilled nursing facility. I don't have much
Oh,
pull
okay.
with them. The assisted living's a do, but not
That's what
that.
I mean. All right.
Which April has more pull since she actually does that part. But I am excited about it. I think it's going to be a great thing because, you know, when something does happen, whether it's skilled or assisted living, we, adult services, DSS, has to be there. We have to make sure everything's followed through completely. We got to make sure it runs smoothly.
Yeah.
And last time we had to do this, we had to have staff 24 hours around the clock. So, you know, it's good for all of us to be involved and all of us to know this.
And that's one thing a lot of people don't know is some of that DSS is responsible for when a home has to shut down, that if.
I didn't realize that, yeah.
So if the individuals are unhoused at that point, then we are responsible for finding placement or providing some sort of
The
shelter
last
for them.
facility that shut down, we had to be there and provide 24-hour staff on site. And we also had to find placements for all those people. Now, that wasn't a disaster emergency evacuation, but it happened really quick. So it was, yeah.
Yeah.
Well, it does happen. And we
does.
need to be ready for it. And I commend you guys for
Well,
having the
like
initiative to put it together.
one Christmas before last, we had a facility, it was so-called the pipes froze.
Yep.
Oh, no.
Well, it flooded. Thank goodness it only flooded 5 rooms, and they were able to find housing with the families. But if it flooded the whole building,
Yeah.
Yeah.
you know,
And if that disaster plan wasn't up to date, then that
Yes.
wasn't going to be of any help. And so that's what we ran into with the facility when we thought we might have to quarantine or evacuate some folks who, but luckily that did not happen. And so we're hoping that this training will help them get those plans up to date.
and then have us, all three, the hospital, EMS, and us all on the same page.
Yep.
Yep.
Nice.
That's great. We'll come back again in, when's that training?
February 7th.
Maybe you come back in March and give us an update on how that went.
Okay, sounds
Or
good.
have somebody give us an update on how that went, if you don't want to come.
They love to come.
April, you got anything?
Nope, she said it all.
Y'all okay?
Did it.
Y'all did a
you
great
both.
job. Thank you so
Thank you,
much.
guys. Thank you.
All right, next on our agenda is introductions, and we'd like to take this opportunity to, I guess Ms. Kim here is going to introduce our new child support supervisor.
I am. So I'll stand up with you, Brian. You can come on up. I won't make you stand up here by yourself. So Brian Robbins took the supervisor position that CV retired from, and he started that position in December 1st of this year. So Brian came to us from the Department of Public Safety, where he worked for 16 years?
Come on, 17 years, yeah.
Okay, so 16, almost 17 years. And part of that time, and I don't know how exactly much of that time, was in a lead position. So he had the opportunity to supervise staff and so got some supervisory experience doing that. So then he came to us in 2022, February of 2022, and he worked up until November as a child support agent, and then took the lead agent position then, and then was promoted to supervisor in December. So he has moved up quickly, and we have enjoyed having Brian, and we're excited for him. And he's been doing this now for a few months, because we were going to introduce him in December, but since it was not, it was a little bit more of a slimmer
Informal,
meeting.
yeah.
Yeah.
So we
Yeah.
decided to let him, we waited so that he could be introduced to the majority of the board. And
Well,
you wanna say
congratulations
anything?
on the promotion. And
Thank you very much.
Absolutely. Congratulations, Brian.
He held a very important role in our leadership skill over Christmas as well. So he got broke in
Saw that.
just right.
Yeah, I did.
Yeah. Did a really good
Welcome
job
to
of
the
that.
team.
Yeah, exactly. Yeah. There you go.
Yeah.
Yeah.
Thank you, Brian.
Thank
At
you.
least they didn't have you in the tights. You know? Thank you for coming tonight, Brian.
Hey, thank you.
Appreciate all your hard work. All right, next is going to be the moment we've all been waiting for. The financial report, Mr. Chris Conlon.
As always, thank you, Donnie. I don't know what I'd do without your introduction
I'm telling you.
to get me through the meeting. Not only do we have a monthly report to look at, but behind it, you should have a budget mid-year review page that we'll look at as well after the monthly report. So our December reimbursements totaled $608,919. We ended the month with receivables of about $1.4 million. The expenses for the month totaled $1,291,115. Therefore, our county dollar utilized in the month was $682,196, and that is a little on the high side, and we'll talk specifically about that when we get into the highlights at the bottom. In our current year-to-date comparison to the prior year, expenses are up a little over $193,000. Revenues are down $206,000. Therefore, our county dollar is up almost $400,000, which that will tie in with the other explanation in the highlights. And looking at those highlights, we identified some areas to show or tell you why our expenses are up at this point in the year. Our foster care board payments are up about $30,000, which over a 6-month period is really insignificant, but it is an increase. So I just wanted to mention that. Our adoption assistance cash payments to eligible families is up $83,000. Now that is an all-county expense, and the increase is simply due to the rate increase announced by the state in May that we didn't get the budget for because they did announce it so late. So that's a pretty significant increase in that area. Of course, by the end of the year, we're going to be easily $150,000 more than we were last year in that expense area. So we will be requesting more money in next year's budget for that expense. Also, we have an increase of about $94,000 in staff expense at this point in the year. That's simply due to we have 13 more positions in our budget than we did last year, not all of which are filled at this point, but the majority of them are. So, again, those are just some areas we identified where our expenses are up at this point. Of course, those 3 areas alone add up to more than the $193,000, so we've got some areas where we're a little under where we were at this point last year to offset that. Foster care expenses will continue to increase as we go through the year, assuming, our placements remain kind of level with last year, simply because we're now paying kinship providers a monthly stipend. So that is running about $10,000 or $11,000 a month. So not a major expense, but over the course of a year, it'll add up, although it didn't begin until December, so we won't pay for the full year in this first year that it's been implemented.
Yeah.
The last little note at the bottom ties into our year-to-date numbers. We anticipated receiving additional revenue exceeding $452,000 in December, which was not received until the first week of January. So we ended December being a month behind last year as far as our revenues coming in. So that's why the year-to-date numbers look, well, they look bad because they are, but it's because the late revenues, had that revenue been received timely, would be about $53,000 under. Our county dollar would be about $53,000 less than what it is, less than what it was in fiscal year 23 year to date, and that's mainly due to the expansion funding we've received this year. Any questions about our monthly report?
No, sir.
Our mid-year review basically hits the highlights of our budget, and I'm simply going to try to hit the highlights of the review itself. Our salary expenses were under budget, were projecting to be under budget, almost $900,000, which obviously that seems like a high number. That's only about 8 or 9% of our budgeted staff expenses, because we're budgeted for about 10 and a half, maybe 11 million total to cover staff expense. Operational expenses, were good in most of those areas. We were overspending postage a little earlier in the year and had to transfer some money to cover that, but overall, we're in good shape. Foster care, room and board expenses, and child resources. Our state foster home is overspending in those room and board payments simply because fewer children are eligible for the 4E funding, which is the higher reimbursed of the two foster care funding sources. But thankfully, 4E is underspending, so yeah, at mid-year, we were overspending. However, during this month, we've already transferred $350,000 from 4E to state foster home to hopefully manage that overspending for the remainder of the year. So we hope we're okay there for the second half of the year. I had mentioned the adoption assistance cash payment being an area leading to our total expenses being up for the year, and we're actually projecting to overspend that expense line by about $90,000. So in adult resources, in our rest home expense line, we're underspending it, projected amount of about $100,000. So earlier this month, we also transferred $95,000 from that line to cover the overspending in the cash payment. The remainder of the review, pretty insignificant numbers in the grand scheme of things. If you have any specific questions, I'll try to address them.
I just know that there's a lot of this that, you know, we can't control from the state level. So when you look at this and people say, well, you're over budget, there's a lot of this we can't control, so.
Yeah, and a couple of weeks ago, I went to a regional DSS fiscal officers meeting, and there were folks from 13 or 14 counties there, and everybody has this same issue with overspending in foster care this year because nobody was able to budget for it. So
we didn't know what to budget for.
Right.
Yeah.
Right. So hopefully, we'll be set up better in next year's budget without any additional rate increases.
Yeah.
Or if they were to announce more, they'll do so early enough that we can budget for them.
Right. All right. Anybody got any questions for Chris? As always, buddy, we appreciate you, my friend.
Thank you.
Thank you for being here. Next on our agenda is Director's Report, Ms. Kim Arnett.
So you have your personnel report, so we'll look at that first. And as you can see, there were a few positions vacated since our last meeting. A couple of those were retirements, and there was a couple of those also that were promotions. And so we were able to fill more positions over the past month than were vacated. So that's a positive trend, and we hope that we can continue that trend moving forward. I know that as of now, we have 2 hopeful prospects for our last 2 Medicaid expansion positions. And if we're able, our goal is to get those hired by March the 1st. And if we're able to do that, we'll have all 10 positions filled. So we're excited about that. We are beginning to work on our budget preparations for this upcoming year. Chris and I have begun that process, and we've met with the county manager and finance officer and talked through some things. And so we are actively working toward that process. We're going to be meeting with our individual program areas, which we've already done, but we will do that in a follow-up meeting to find out what areas we may need some, whether we need to upgrade some positions or whether we may need to ask for more positions. We're going to be talking through all of that and seeing what is truly needed as we move forward. There are, I was talking earlier about some of the policy changes, and I had mentioned that there is an upcoming change with Medicaid that they're having to train on or have had to train on recently. And that change, we hope, is going to be helpful in the long run. But if you know what the federal facilitated marketplace is, and so that's an online marketplace where citizens can go on and they can purchase health insurance or they can apply for Medicaid. And so they call it the FFM. And so we get referrals through that online marketplace where people have applied for Medicaid, and then our staff have to work those applications. Starting February 1st, the marketplace is going to start determining eligibility, so working those applications. Now, this is supposed to be a good thing.
That sounds good.
There will be a lot of applications probably that, quote, fall out, which means there are pieces missing that our staff are then going to have to follow up with and figure out. There may be incorrect information. So in the beginning, it's going to be difficult, but we are hoping over time that it does reduce the workload on our staff, or at least reduce some of the task that they have to do with these applications. So that's something positive coming up. I know our staff are somewhat worried about it just because they're worried about if there's an error with the marketplace. If the marketplace makes an eligibility error, the counties are saying, you're not going to hold us responsible for those errors. And so we've posed that to the state, and the state has over and over again said, if it is an eligibility determination made by the marketplace, the county will not be held responsible. So we are going to, as a state, as a directors association, going to be holding them to that. However, if there is a change in their circumstance and we have to then rework it, then we will at that point assume the responsibility for any errors. But that initial determination, if they've made it, they should be responsible if anything is an error.
Do you anticipate any barriers for citizens that are potentially applying for Medicaid using that system versus those applications coming through DSS?
Not really, no, because the process will be very similar. I mean, they're going to be forwarded to the counties. They're going to be, once they've either, whether it's gone through the entire eligibility determination process through the marketplace, or whether it was dropped out because they need more information, it will still be about the same timeline.
Yeah, it's my understanding, this came up at our, Board of Directors, VIA Board of Directors retreat last week, and the marketplace is just another avenue. So the person, if they go to the marketplace to do something else, that they're going to capture all this information, and then, or if they don't go to marketplace, they go straight to DSS. It's just another avenue for the consumer or the person to take to sign up for Medicare.
They're hopeful that this will be the primary place for folks to apply eventually.
Eventually.
Now, that will take some time. And again, those processes will need to work, and so we'll see how all that goes. But we are hopeful that it will be eventually a help to our staff.
And we do think, we're pretty confident there's more people that's going to be eligible than what we're expecting.
Yeah, that is true.
So we don't know what that number looks like yet, but we know it's higher than what the predictions have been, or the estimates have been. Anything else?
That's all.
You all good? Anybody got any questions for Kim? If not, we'll move on. All right, next, we've got Children's Services and Adult Highlights. Miss Laura Harrison, Child Welfare Program Administrator.
Good evening. Hey there. So in your packet, you have a paper, again, like last month. I'm not going to read it to you this month. It has the last 3 months on it, so October to December. In December, you'll see trending down from October. We've went down in numbers, especially in CPS intake and CPS assessments, which is typically a good thing. And we typically do see that happen in December. And normally that is because there's that Christmas holiday. So things seem to be going well, but also school's not in session. And the rest of the numbers were pretty consistent. compared to like the month before to November. So any questions about those numbers?
No,
So-
but I really appreciate the fact that you put that so that you can actually see the trends there. It really does help to be able to kind of compare where we stand to where we've come, so thank you.
Absolutely.
You talk about December being down because of the school being out. Is that because we get a lot of reports from the school?
We do see several reports come in from the school, yes.
Okay.
I'll say for the highlights for children's services, you've heard Crystal talk, so put her back in the spotlight. But I will say that she has also lined up, and she does do this now 2 or 3 times. This will be happening. We have a drug and gang training that's coming up in March. That the gang coalition comes in and trains our staff on that, and also some other agencies come in and help with that. But we host that and have them come in and help our staff educate them on drugs and what to look for potentially, and also gang affiliation. So unfortunately, we do have gang affiliation in the county, so to help educate them, so and for their safety as well when they're out on these home visits and in the community. So put her back in the spotlight. But the staff really do enjoy that training. So that is coming up in March, and that is at our building. I think March 6th is what it is. And it's an all-day training, so I think it's gang in the morning and then drug in the afternoon, or maybe vice versa. But so
We try to open that up to adult services too, I think, so that the adult services social workers can come too. So.
And then also we're preparing for an audit, the CFSR, which is Child and Family Service Review. So they pull a case and they look at the services that are provided to the family. So they not only review that and see, make sure that we're doing what we need to be doing, but with doing that, they also talk with the social worker, the supervisors, or supervisor. They're going to talk with family that we're working with to see, their input on how we're doing. They talk to the foster parents or the placement provider for the children on the case. Anybody that's very pertinent to the case, they come and interview them, and so that's happening in March. So we're preparing for that as well right now.
Good.
And then adult services at the bottom there, again, their numbers about the same. Again, a small drop in those numbers, as you'll see. We finally have filled the vacant position that we have had in adult services. Now, it's been vacant for a while now, and we just recently filled that. So we're very excited about that. So as of today, knock on wood, adult protective services is full, and all of adult services is finally full. So I know Beverly and April left, but they're ecstatic about it. So
I'm sure.
and I will just say, for their highlight, when I was talking to Beverly, they recently went through their very first jury trial. They had lots of feelings about it, and so it was the very first one that we've had, is my understanding, ever. It was for a competent adult. It was an appeal. And so some staff were very excited about it, and some, were nervous about it, but we did have that. So
What was the outcome?
So, do you want me to talk?
It's fine.
You can.
No, you're fine.
Okay. So it was an adult who was deemed incompetent, and their attorney and that adult filed an appeal to restore competency, and they did win that, to restore the adult's competency. And so that, it's, for us, it's not really a win or lose situation.
Right.
It is, we know that we have to do what we know to be best at the moment, and if the judge or in the adult services world, if the clerk or the jury now at this point makes a different decision, then that is what the legal system is for. And so that adult did have his competency restored, and so we're wishing him the best. And it, like Laura said, it was an interesting situation. We actually have another jury trial that's going to be coming up. This is now 2, and we had never had one of these before. And so luckily, Mr. Potter has had experience with jury trials, and
Not me.
Steve Potter.
Yeah.
And so he was able to prepare our staff and work with them, and so they felt, I guess, more confident as they went into this. And but yeah, they were
It's a
quite
learning
nervous about it.
experience.
It is. It is.
I think after it was all said and done, they somewhat appreciated the process, I would say.
Yeah.
I would find it interesting. I'm sure you
Yeah.
learned a lot about,
Well, they got to see the whole, selecting juries and what that looks like.
Yeah.
So
Well,
it was.
you took it from the start, from the very beginning, all through the whole process to the very
Absolutely,
end.
yeah.
Yeah, and our adult services folks, they go before the clerk. They don't go before the judge.
Right.
And so that was quite a leap for them.
Yeah.
When they're used to being in a hearing with the
And you
clerk
had a
versus
jury
the jury.
trial.
Right.
Which you had 12 jurors, I guess, that decided that he was competent. So,
Correct, yeah,
Yep.
yeah. So it was very interesting for them.
Good.
Yeah.
Well, it's
Any-
good when the process works.
Yes, yes.
All
So
right.
any questions about
Anybody
any of
got any
that?
questions for Laura? All right.
Okay, thank you.
Thank you.
Next is the Family Support Services. We'll let Ms. Starnett do that.
So I will just talk about the highlights that Brandy was going to mention. If you look at her chart, and you can see that for our food nutrition services, their increase from last month to, November to December, so this is last year, they had a above 50% increase in food nutrition services. So, what we equate that to is a lot of times when people come in to apply for, say, Medicaid expansion, then they're also going to apply for the other services that are available. And so you see that increase there. Then you look at, I'm just going to point out, and I'm going to read the numbers out just for the people who are maybe watching, 287 to 436. Like I said, that's a over 50% increase. And so then you're looking at our Medicaid services. And you see in November, 540, and then you see December, 1,154. So I am not the math genius, but I think I calculated about 114% increase there. When you look at the number of individuals receiving services, you can see that, interestingly, the number went down. And so a lot of counties have seen this, and so people are being denied, but then they're reapplying. And so these Medicaid expansion applications have not yet been worked or approved. And so what you're going to see is once those applications are approved, you're going to see that number of individuals receiving services increase. And so right now, in the 25,677 individuals in the county who are receiving Medicaid is approximately 32% of our county population. And so that's going to increase as we see these applications being processed. The other number I just want to point out is our emergency assistance. And so right now, we're in emergency assistance season. And so you can see that November we had 354 applications, and in December we had 637, which is about an 80% increase there. So our economic services staff have really been busy.
Is that number being driven by people coming in to apply for Medicaid as well?
That maybe
don't even
some
know
of
it's there.
them, right? Some
may
of
not know
them,
it's there.
but a lot are probably more just getting the energy assistance.
Well, we had a
And
bitter cold week there.
We did.
Week and a half
We
or so,
did.
so, yeah. Kind of makes sense.
so the other highlight that I want to talk about, just a couple things real quick, is our food nutrition services have a process in place where you have certain staff who are only taking applications, and then you have other staff who are doing the annual kind of recertification of these cases. And so what we did was we looked at some other counties and how their processes are working. And what we've decided is we are going to what's called go universal, which means all staff will be trained to do both tasks. And so that will then spread the workload across all of our food nutrition staff so that their caseloads are lower and they're spread out evenly. Because what we see is, let's say in December, the application side was really heavy, but just a few months before that, that recertification side was really heavy. And so this just gives the opportunity for the workload to be more evened out and to not have those huge spikes. So Brandy met with the supervisors in that area and then also met with staff, and everybody is on board for this process change. So that will be beginning. We are doing some training right now because some of the folks who only did applications need training in the other area and vice versa. So as soon as they get trained, we're going to make that process change, and then we'll be looking at any other area in which we need to look at processes to see if we can be more efficient.
And I would think from the from the customer end of that, right, does that then also allow that the same person that has processed their application will also be doing their recertification, so there'll be consistency?
Perhaps.
Yeah.
Yeah. Depends on how the caseloads are divided up.
Right.
The other, we talked about emergency assistance just a second ago. We are out of crisis funds, but we are expecting another allocation from the state soon. So usually that happens about 2 or 3 times a year, where they'll reallocate funds from other counties that aren't using their funds, and so we usually will see another allocation. So we will ask for that once that happens. And then just to talk about child support real quick, you know, we are one of the few counties that's met over half of the required collections for the year in child support. Our child support area is just always top notch. They've been passing all of their self-assessment goals for the incentive program, and even with multiple vacancies, they've been able to keep this. They've been able to meet their goals, even surpass some of those goals. So I wish Brian was still here so that I could say that and, you know, acknowledge him in that, but I want to acknowledge the entire area because they've done really well.
Yeah, we've always done a good job there. All right, anybody got any questions? All right, thank you, Kim. With that, I will, we'll go to the next item is our next meeting will be on Tuesday, February 27th at 5 o'clock here in the same location. Anybody got any questions? Anybody want to say anything else before we adjourn? If not, I will entertain a motion to adjourn.
I make a motion to adjourn.
Second.
All in favor, please say aye.
Aye.
All opposed, motion carries. Thank you for joining us this evening. We are adjourned.